Good afternoon. I'm Don Walker, and I'm Communications Director for Brevard County Government. Thank you for joining us today for our weekly update on Brevard County's COVID-19 pandemic and the status of what's happening in our community. On our panel today, we have Maria Stahl, Administrator for the Florida Department of Health, Brevard, John Davis, who is also with FDOH and is their Community Health Coordinator, John Scott, Emergency Management Director, Mark Schomeyer, Chief of Brevard County Fire Rescue, Ian Golden, our Director of Housing and Human Services, Catherine Allen, who is a coordinator with Brevard Public Schools. We also have today as our guest Commissioner Kurt Smith, who represents District 4 in Brevard County. And we have our social media specialist, Jesse Ray, who will be monitoring our Facebook Live event for your questions, which we will try to answer before the end of our program today. So to get started, we'll turn it over to Florida Department of Health and John Davis. John?
Hey, good afternoon, everyone. Unfortunately, we've come up again in cases from last week. We had a total of 4,550 cases over the last week. That's an increase of 200 over the week prior. That has brought our case rate to 744 per 100,000. Vaccination-wise, we did 6,225 vaccines, and that is a decrease of 1,000 doses over last week or the week prior. So really not a good combination there, less vaccinations and increasing case rate per 100,000. So again, we urge folks that are eligible, please get your vaccination. It's still not too late. It's extremely effective, and we urge you to go in. There's plenty of places to get it throughout the community, including our own health department. We did start adding the additional vaccine for those that are eligible. So if you've been fully immunized with your 2 shots of Pfizer and Moderna, I want to read through who's eligible to come in now for that additional vaccination. I know there's probably going to be some questions about the booster dose. Right now, we're awaiting further guidance. You've probably seen in the national media that in September, it looks like they're going to be opening that up for all vaccinated individuals, regardless of status. So we should have further information as we move along on that. But as of right now, with the additional dose, it's those that have been receiving active cancer treatment or for tumors or cancer in the blood, receiving an organ transplant, received stem cell transplant within the last 2 years, moderate or severe immunodeficiencies, advanced or untreated HIV infection, and those on immunosuppressive drugs. Those folks are eligible to come in for that additional dose.
All right, thank you, John. Because our panel is getting so big, I neglected to introduce Matt Wallace, our Public Safety Director, so my apologies, Matt. There's been a lot of talk in our community this week about monoclonal antibody therapy treatment, and there's also a lot of communication and monitoring and coordination going on between our emergency management department and area hospitals. So for an update, I'll turn it over to John Scott.
Good afternoon, everyone. Again, my name is John Scott. I'm the Emergency Management Director for Brevard County. I'll talk about a couple things, and I will start with the monoclonal antibody treatments that were now being offered at the Kiwanis Island Park. That's a partnership we entered into with the state of Florida and the governor's office, and we're extremely appreciative to both the governor and his team at the State Emergency Operations Center for working with us to make this treatment available to our residents. It's at Kiwanis Island. It's in the main building there. You can also get it at Parish Medical Center or Health First, but the larger volume capacities is at the Kiwanis Island Park. Let me talk a little bit about what monoclonal treatment is. Basically, it provides an immediate boost to your immune system, sort of so you can get that increase in your ability to fight the COVID virus. That allows, it's really targeted for people who are COVID positive or for people who believe they had a close contact with an exposure for COVID. We prefer appointments at at the site, which you can get to through the patientportal.com, or they are taking walk-ins as well. And it really is important if you're not feeling well, especially if you've been diagnosed as COVID positive, if you are symptomatic with that, we really want folks to go get that treatment. It is making a difference across the country. We've seen research that it supports that. And its primary goal is to keep your symptoms down to that medium or mild range and keep folks out of the hospital, which, as we've been talking about for a while, is a critical step to decompressing our overall healthcare system. When we're talking about the importance of what the monoclonal treatment is, I want to also sort of set some expectations for what you can expect when you come to the Kiwanis site. One, we want everyone to make sure they're well hydrated, had something to eat going into this. Some folks will feel a little nausea after the treatment. This will help mitigate that, plus just in general, being well hydrated and having something to eat helps for any sort of medical treatment. Two, when you get there, it will take about an hour and a half or so once you start your treatment, and there is a bit of a line, so don't be surprised if it's 2 hours or more that you're actually on the site. When you go in, you'll register, you'll sit down, they'll treat you. The treatment is subcutaneous shots, so it's 4 shots, 1 in each arm and then 2 in your stomach. From there, you'll then move to an observation area where you'll be monitored for an hour. Again, we want folks to go hydrated with something in their stomachs as far as food goes, and also encouraging folks, bring a book, bring something, bring a tablet, bring some music to listen to, because you are going to be there for a little bit. It is a lengthy treatment. We're going to ask for folks' patience as we go through this. We're day 4 in that site, but the really positive news I have on it is, as of noon today, from noon on Tuesday when we opened, we're at 452 people treated. So that is a big difference that it's going to make for us in our system. Those are good numbers for us. We have the capacity to do up to 300 a day at the site. We're averaging about 170 so far in our full days. We're continuing to push that message out there to the community. We want you to come, especially if you're not feeling well. This will make a difference. And again, this is a treatment option that we haven't had in the past. Being able to make it available on this scale is critical for us. But I also want to highlight that it does not replace a vaccine. It is intended as a short-term fix to make sure that we're mitigating and keeping your symptoms medium to mild and avoiding that severe hospitalization requirements. But you still need to be vaccinated. If you receive the monoclonal treatment, it'll take you got to wait 90 days before you can be vaccinated. So if you're COVID positive or you're symptomatic or you've been exposed, again, we want you to go to this site, get the treatment, keep your symptoms medium to mild, then wait that 90 days, come get vaccinated, and we continue to work for more ways to protect our community. Don, we talked a little bit about the hospitals. I'll continue just to touch on the idea that we continue to see a surge in our hospitals. We continue to know that it's stressing our medical system. Again, one of the reasons why we got the treatment site from the state was because of the level of surge we're seeing, and they're, not just us, but statewide, wanting to try to find ways to decompress that system. We talked about last week the importance of ending the transmission cycle. That's the stuff we can do as community members to help slow the spread. When I say in the transmission cycle, this means if we're sick, we stay home. We don't go out and meet people. We don't do those kinds of things. We wear face coverings. We wash our hands. We practice social distancing indoors. We've really got to figure out a way to get this and start to change our community behavior for the short term so that we can begin to get a hold of what this is doing. Again, we know this is cascading, right? We know that not only is our healthcare system surging, but as our healthcare system surges because of the amount of virus, we see it in our community. We see that means school kids have to quarantine. That means parents have to miss work. That means we have folks who are sick who are trying to figure out, how are they going to get treatments? And again, the monoclonal will help. But each one of us, as a community member, as a neighbor, can make a difference. If we're not feeling well, we're staying home. If we're doing our good COVID mitigations, we can make a difference. And we've got to do this. This is not a government solution. This is not a state solution. This is a community problem that requires a community solution. So please, help us do that. Help us make a difference. Don.
John, Commissioner Kurt Smith has a question he would like to pose to you.
Sure. Commissioner, how are you?
I am just peachy keen, thank you.
Wonderful, sir.
You had a lot of great information.
Yes, sir.
I have a question with regard to the monoclonal treatment. When a person comes to that facility, do you test them to see if they're actually COVID positive?
No, sir.
So they could just come in and say, I don't feel well? And
Yes, sir.
I
So
would like to
the
get
Surgeon General, when he issued the order that we're all operating under to provide the monoclonal treatment, did it for 2 cases. If you were COVID positive, and all you need is that as a test, to just say, hey, I'm COVID positive, you can go get the treatment, you don't have to show your test, or as a prophylactic or preventative for those people who have been exposed or close contact to COVID.
Good. I think that information is very important because there are people out there that might be able to take advantage of it that may think, well, I don't really have any symptoms yet, so, or I don't really feel that bad, so I'll wait and see if I get worse tomorrow. So it would be important for those people to know what you are offering.
No, that's an excellent point. Again, we want folks, as soon as they're symptomatic, as soon as they're not feeling well, this stuff works. It's most effective the earlier you get it. I know that, Don, we put out a fact sheet today to help answer a lot of those questions that we've been getting, a frequently asked questions sheet that went out today to help try to set expectations and really provide an idea of what's happening. But Commissioner, you're 100% right. The sooner folks can go out and get it, especially if they're symptomatic, the better they're going to be.
So as John mentioned, my office has been putting out daily correspondence on social media and through press releases on things like where you can get vaccines, where the clinic is located for the monoclonal therapy, which is in Merritt Island, of course. So on a daily basis, we're putting out information on this as much as we can. Brevard County Fire Rescue is our frontline responders to this pandemic in Brevard County. And for an update, I'll turn it over to Mark Schomeyer, the chief of BCFR.
So thanks, Don. I always like to start out these Facebook Lives with just a little overview of the health of our organization in terms of COVID. As of Wednesday, BCFR had 5 employees in quarantine and 18 in isolation, and we have a few that are returning to work this week or next week. So that's an ever-changing number. We are still seeing a steady number of transports of COVID-positive patients and COVID-symptomatic patients over the past week. The daily hospital wait times for our BCFR ambulances has improved since the end of last month. The bulk of the daily at-hospital times for our ambulances is in the 0 to 20-minute range, which is fairly normal, with quite a few in that 20 to 60-minute range, which is abnormal, and then there's a few more that are over that 60-minute range. I'm always cautious to use the term trend, but it appears that the at-hospital times for our BCFR ambulances are on a slight downward slide. The daily EMS call volume, as well as the number of COVID-positive patients, has spiked in the first couple weeks of the month. Again, for the fear of using the word trend, there seems to be a slight decrease over the past week in terms of those numbers heading downward. In spite of what seems to be better news from a pre-hospital EMS perspective, we continue to ask people to only call 911 for emergent and life-threatening issues and to please save the ambulances and ER trips that urgently need them. Our agency continues to work with the hospitals on a daily basis to ensure we are doing everything within reason to assist them with the capacity issues. Lastly, when and if you do call 911, we will always respond. There's been no delays in BCFR getting our EMTs and paramedics to the scene of emergencies, and we'll always be there for you. Thank you.
All right, thank you, Mark. And likewise, Commissioner Smith has a question he would like to pitch your way.
Chief, what's the difference between isolation and quarantine?
So in quarantine, you have been exposed to somebody with COVID. Don't necessarily have the symptoms. You have been exposed to somebody in close proximity. When you're in isolation, you have had COVID, and then you are separated from people.
Thank you.
John, you have something to add to that?
Not to that specific point. Chief did a great job on that. Just 2 backsies for me on the monoclonal site, just some clarifications. One, I mentioned the patient portal that folks can sign up for appointments. I just want to make sure I get that address right. It is patientportalfl.com. And then 2, another important part on the site is it is free. We get that question a lot. Is it free? Is there a charge? There is no charge. It's free. There is no copay. Your insurance company, you'll be asked for your insurance information if you have it. Your insurance company may get a small administrative bill, but there is no dollars to you, and you don't have to have insurance to get the treatment. It is 100% free.
And if I could also, there's no need for a doctor's note, doctor referral. It's like what John had said earlier. If you have the symptoms, if you are COVID positive, come in and get it. It's a free treatment, and we'll make sure we take care of you there at the site.
Okay. And Matt, while you're talking, do you have an update from public safety?
It was the insurance requirement that has been waived, and it's a free service that we're providing for Monoclonal.
Okay, thank you, Matt. And so COVID, whether you've been infected by the virus or you have a loved one that's been infected, we know it's taken an economical toll on members of our community, whether you're a business owner or your job has been affected, or like I say, someone in your family's contracted it. We know it's created some economic hardships. And we have Ian Golden, our Director of Housing and Human Services, here today to discuss a couple areas that will let you know that there's assistance available out there for you. Ian?
Thanks, Don. Yeah, just some real quick. We have our emergency rental assistance program that's available for people who have been directly or indirectly financially impacted by COVID. We talked at the last Facebook Live. We went through the application and the process to apply. Just some updates. We're up to 1,686 applications. That's initial applications plus repeat applications, because people are allowed to come back and get prospective. So if you're still having trouble, you're allowed a certain number of months to get assistance. So we're able to continue to help you. We have about $12.3 million out of the $18 million that's left. We're averaging a little over $4,500 a household in assistance. I do want to just real quick touch base on what was mentioned earlier with the kids who are quarantining and the parents who are being home. So that is, if you are a working parent and you have to stay home with your child and you don't have leave, and so that's a loss of income to you, that makes an impact. That is a direct COVID impact you can apply to our rental assistance program for assistance. So just some quick stats. I do want to spend most of my time, though, talking about evictions. What we've seen in the last 8 business days, there's been 42 evictions for non-payment that have been filed. We're currently working with 9 of those households. They've already applied. We're in the process of mailing out applications to the other households, which is something that we're going to be doing moving forward. As we find out there's an eviction, we're able to pull that. We're able to then send them a application if they haven't already applied. But I want to talk about the process, and there is a point in the process where it's too late for us to assist. So the process starts with a renter falling behind on their payments. They then will receive a notice from their landlord that their rent has to be paid by a certain date. If that rent is not paid, what they'll get is a summons or complaint for eviction. Once you get that summons, and a lot of times it's attached to your door, the renter has 5 days to respond to the court. If you don't respond to the court, there will be an automatic default judgment in favor of the landlord without a hearing. If you do respond in those 5 days, you'll get a hearing date. The date itself is really dependent upon the judge's docket, their calendar of other cases, and it could be anywhere from 5 to 30 days out. So usually what will happen in the hearing is you'll get a final judgment at the end of it. And the final judgment will basically say, here is what you're owed, what you owe, and it's usually what you're owing in rent. You're going to have fees added on that. That could be court fees. That could also be attorney's fees from the landlord. And you will have a certain time frame to then make a payment into the court registry. If you make the payment into the court registry, you're able to remain in the unit as long as non-payment is the only reason for the eviction. If no payment is made or only partial, you will, at the end of that time period, there will be what's called a writ of possession. And that means you basically have 24 hours to vacate the unit, or law enforcement will remove you from the unit. And typically when you get to that point, that writ of possession, there's no ability for us to help with paying rent. It's not going to change the outcome. So what we encourage is that people who have an eviction apply as soon as you can, apply as early as you can. It gives us more time to try and get you approved for the program and hopefully keep you in the unit. One of the things that we're seeing, though, is that because evictions are on the rise, they actually take more time for staff to process. They take more time for us to go back and forth with the client, with the judge, with the attorneys. So what we're seeing is all of our other applications, their processing time is increasing because evictions right now are they've always been a priority. So again, don't wait too long. We have a process in place. Even if you have a final judgment, again, I would apply before that, but typically that's a 5 to 7 day period. We have a process in place for us to be able to make that payment to the court registry. Typically, we can't cut a check quickly enough through the county system. Usually takes at least 2 weeks, but we have approval that we're able to use our county credit cards to pay directly to the court registry for approved applications so that we can jump in and try and, again, stave off that removal from the home. All right.
All right, and the ever-inquisitive Commissioner Kurt Smith has a question for you too, Ian.
Sure.
Thank you, Don. Well, I'm sitting here and I'm trying to be like every man, the person that's out there and can relate to what you're saying. And I was thinking when you were talking about the process if someone misses some time at work because they don't have any leave and they have to take care of their child, is there documentation that they have to provide? Because typically people have COVID and they stay home. They can't get to a doctor and confirm that they do have COVID and go back to bed and stay at home and rest. Is there some documentation? How does the parent go about applying for that?
Thank you, Commissioner. It's a good question. What we typically do for income certification is if you've done your 2020 taxes, we use that in general. If your income has changed between then and now, we just ask you to provide us something to prove that. So it might be your pay stub. It might be, and I don't know, I apologize because I don't have any more school-aged children, but it might be, I think there's a notice that comes from the school. I don't know if it's by phone or if it's an actual, like an email or something. That could be enough to show us that there's been an impact. So yeah, we will look at that. We'll do that due diligence. Just people be aware that every time we have to do that due diligence, that it's not provided to us automatically. It does take time and it does slow process down to do that back and forth with the client and potentially anyone else.
Well, thank you. And I think that clears it up because I'm thinking if I'm a person out there listening to this, they may just say, well, I'm not going to bother because I don't have any way to prove that my son had COVID. But as you said, you can document that through the school. And so.
Yes, and actually the application itself, you write in there's a narrative section where you can put in what your impact from COVID is. A lot of times we don't ask for people to give us medical records if they tell us they've had it. They're attesting, there's an attestation that's a part of the application that they're attesting that it's true and correct. So part of it is that we're kind of trusting the people to let us know where we can, because honestly, I don't want medical records.
Right.
I don't want those, so, I want to take people at their word. But that being said, if there are things in an application that raises questions, staff will dig in deeper and ask for additional backup documentation.
Thank you. Good to know.
Thank you. Thanks, Don.
Thanks, Ian. All right, so obviously schools are on the minds of a lot of people, and for an update from Brevard Public Schools, I will turn it over to Catherine Allen.
Thanks, Don. Before I begin, I just want to briefly let people watching know that I will continue to take my mask off so the people in our deaf and hard of hearing community can also understand the updates that are happening in Brevard Public Schools. We think that's really important. So just a few things. First and foremost, if you have a child at home who is experiencing symptoms of COVID, whether or not you know it's COVID, please don't send their siblings to school. If you have a child who has any symptoms that could be COVID related, please keep all of your children home until you have confirmation of whether or not that student or the other child in your house that has symptoms, whether or not it is COVID. If you send your other children to school, your other siblings, and your other child is positive, you are continuing to spread it into other schools. So we're just asking you, please, if there's one child that's unwell and has symptoms, please get them tested and don't take their siblings to school until you know for sure one way or another. Our schools will work with you with attendance, particularly with COVID things. We're having a lot of misinformation that we're seeing, that students that are on quarantine, because obviously our quarantines are high, our cases are high, we're reflecting what's happening in our community, that our quarantine students don't have access to education. That's emphatically untrue. We want to make sure that we take a minute to clear that up. Every student who is quarantined has access to a quality education. Now, it's not a one-size-fits-all. It depends on the school. It depends on the age of the child, their curriculum. Many of our classrooms and our teachers have a virtual component, a Google Classroom, something where they can get their assignments, something where they can turn it in and follow along with what's happening, as well as many of our teachers spending countless hours following up with those students that are in quarantine via email, phone calls, you name it. The people in our schools have never worked harder. And I really want to make sure that we reiterate that, because there's a lot of really unkind things that are being said to our staff in schools. We truly appreciate and understand the frustration. Nobody ever wanted to get back into a peak of this pandemic. But what we can't have is having the people that are doing their level best with our children, having their time taken up asking why their child has to quarantine. If your child has been asked to quarantine, it is because they need to. If you have specific questions about why that is, please, we can ask our Department of Health people to weigh in on why it's so important to help mitigate spread in our schools. So the last thing that I want to make sure that I note for people is that yesterday we sent out an update on extracurricular activities. All homecoming dances are suspended. However, homecoming activities like electing the homecoming court, all of the traditional Spirit Week things, all of those things are still going to be able to happen, just not the dance with the close dancing. However, our schools are doing an amazing job helping to plan safe alternatives, just like they've had to do for the past year and a half. So again, we're going to ask for grace and flexibility, and know that your school system is working harder than they ever have to make sure that your kids, we're taking care of our community, and we're serving the families and the people of this community in the best way that we can under an extremely challenging time. That's all, Dawn.
Thank you, Catherine. So we have our social media specialist, Jessie Ray, with us here today, and during our Facebook Live event, she monitors the comments on Facebook Live to see if there are any questions that she needs to pose to our panel, because we try to answer those questions. So I will turn it over to Jessie Ray to let us know what's out there.
Awesome. Thank you, Dawn. So we do have a lot of questions, and I'm going to try and get through them as quickly as we can. So we're going to start with our media questions. For the Department of Health officials, the Department of Health is heavily promoting Regeneron treatment for people with COVID-19, but what are you proactively doing to get more people to get the COVID-19 vaccine, as the number of new vaccinations in Brevard has been stagnant in recent weeks?
So again, as we've been stating at all these meetings, we are offering the vaccination at all 3 of our clinic sites 5 days a week. We have done numerous outreaches in the community, particularly in some of our underserved areas, with outreach teams that have provided the vaccination. We continue to promote it through our social media and press releases. And again, it's widely available not only at our facilities, but throughout the community at many different venues. So it's certainly not an issue of supply or trouble getting it. It's widely available, and it's, again, I can't stress enough how much we encourage folks to please get vaccinated. It's our biggest tool or most effective tool in the toolbox in combating this pandemic.
Okay, thank you. John Scott, how would you describe the situation in local hospitals as far as overcrowding of patients and shortage of staffing, and is it getting worse?
So again, like we talk about every week here, our hospitals continue to see a very strong surge. The best way I can describe it is we continue to be at levels higher than we were previously. And you know, while you heard Chief allude to, we're starting to see a small relief there. It is far too early to say anything beyond a small relief. I think we need to see a lot more data before we say it's a trend. So they're full, and they're busy. And there are things we can do as a community to relieve that, and it starts by doing everything we can to end the cycle of transmission.
Okay, thank you.
I'll add to that, Jesse. And just state, hospitalizations, we tend to see hospitalizations 10 days to 2 weeks after we see our cases. And this week, as John Davis reported, has been the highest that we have ever seen. The transmission is higher, the cases are higher. So as we are talking to hospitals, we do frequently talk to the hospitals, and we project out what's going to happen in the hospitals in a week and a half to 2 weeks of what's occurring today. So I just wanted to add that we can reflect on our numbers to what we're going to see in the hospitals.
Thanks, Maria.
Thank you, Maria. So back to the health department. What is the total number of COVID-19 related deaths in Brevard County, and how many additional COVID-19 related deaths have reported in the last week and the last month?
Total deaths are 1,156 as of I don't have the up-to-date numbers as of today. Unfortunately, we add them daily. But certainly, the biggest troubling trend there is we are seeing younger folks die. When I say younger folks, thankfully not pediatrics, but folks in their 30s, 40s, we're starting to see that. Initially, it was elderly clients, and unfortunately, that number's dropped over time. So that's a troubling trend. But again, right now, the total 1,156.
And so is that an increase or a decrease that we're seeing of deaths in Brevard County?
It's about the same.
Okay.
Okay, if I can just interrupt, we've had a couple other questions. I know Chief Schollmeyer's received a question he wanted to ask. Chief, go ahead.
So the question is, and it might be for John Scott or John Davis, is what if you have the vaccine and have a breakthrough case? Are you eligible for the monoclonal treatment?
Yeah, I'll take that. The short answer is 100% yes.
Okay, and Commissioner Smith has a question I know we've been getting, and I know that needs to be answered. So, Commissioner, if you'd like to ask.
Thank you, Don. Well, my question is just this. It doesn't appear that we have a whole lot of testing sites. And a lot of people would like to know if they have COVID. I think the assumption is everybody that doesn't feel good has COVID, but that's probably not the case. Not being a doctor, I don't know that to be sure, but I do know that there are a number of people that have reached out to my office that say that they don't feel comfortable just assuming that they have COVID. They would like to get testing, but it seems like there's no place to get tested anymore.
I can take that, and then John, if you want to add. It's absolutely true that the testing sites have declined, although we are working at the county and working on solutions to ramp that back up again. The testing sites for pediatrics specifically, there's Nightlife Pediatrics, which is a pediatric urgent care in the south part of our county. They are doing testing every day from 2 till, I'm not sure how long they stay open, but maybe all night. They are a pediatric urgent care. We also have Brevard Health Alliance, which is our FQHC. They are testing every day of the week at all of their sites by appointment. But specifically for pediatrics, they're doing a pediatric walk-in in Rockledge and Sarno offices, and that's Monday through Friday from 2 to 10 and Saturday from 10 to 7. That is specific. Other places that are testing are primarily holding their testing now to symptomatic, just because there is so much need for testing that they're focusing on the symptomatic. And that is CVS, Walgreens, and the urgent cares. But as I say that, we are working on solutions to get testing available in the north, central, and south part of our county. And we're working with emergency management and contract agencies to get that up and going. I don't know, John, if you have anything to add.
Yeah, I'll just build on that a little bit. We were fortunate when this whole thing was our sort of last year. We had the big state site, and that did a lot of testing for us in Palm Bay. And again, appreciative for the state to bring that in. We don't have any indications that the state's going to get back into the testing business on that scale again. I do want to highlight that while it doesn't feel like we have maybe significant single-place testing, and testing is absolutely an issue, we do have a lot of availability out there. It is at a lot of sites. It's probably far more widely available this time last year than it was last year, or this time now than it was last year is a better way to say that. The challenge is the demand is at its highest it's ever been. So even though it's, in theory and on paper, more than it was last year, it's not keeping up with the demand, which is why we're working with the health department to try to find additional options to bring that in. Again, it speaks to the level of virus that is in our community right now. And I'm going to say it for the third time. We can do things about that right now, even if we're not getting tested. We can stay home when we're sick. We can practice our good COVID mitigation measures to, again, help that kind of stuff out and let the system catch back up to the demand.
Thank you, John. All right, Jesse, back to you.
Thank you. So, John, I'm going to kind of swing it over back to you. Are we seeing anything like the viral photo out of Jacksonville where the woman is waiting in line for the monoclonal treatment and is passed out on the floor?
So one, you can never, a picture is worth 1,000 words, but it's also a snapshot in time. We have no idea what that picture represents. So can't speak exactly to the situation they're seeing in Jacksonville. I will say this. Monoclonal sites are for those who are medium to mild, hopefully just symptomatic. If you have severe COVID symptoms, you need to go to the hospital or contact your physician. That's what they're there for. Again, that's what we're trying to do with this balance. Medium to mild come to the monoclonal sites. Severe obviously goes to the hospital to get treatment. And also, again, I'll remind folks that these are folks who are coming there who are sick, who are coming there for a medical treatment. So it's not uncommon that you might have someone who maybe needs to sit down on the floor or lay down. We have folks there that are providing the absolute best level of care we can. We're not a hospital, but we continue to work to augment their resources locally from a county perspective and meet needs as they come up. So we're doing everything we can to provide the best level of care we can there, but there are sick folks there.
Okay, thank you. And so, John, kind of back on that, the monoclonal treatment, is that FDA approved or is that just for emergency use approval so far?
Regeneron is under emergency use authorization for this treatment.
Okay, excellent. Ian, I have a couple of questions for you, sir. So we know that your office assists with rent. What about mortgage? Can people who have mortgage get assistance as well?
Unfortunately, the funds that came to the county were only for rental and utility assistance. The state, however, got an allocation of funds that they will be hopefully starting up soon for a mortgage assistance program. I believe it's going through the Department of Economic Opportunity. So they have a website, and you can, I think, still sign up on that website to get notification about it.
Okay, and I got one more for you. So if someone is renting a house and that owner decides that they want to sell the house, this renter is not behind on their rent, are we still able to help them get into a place to rent with the security deposit, first months, that kind of thing?
We're working on those. The short answer, to use John's words, is yes.
Okay.
It's just the process to get there. Ideally, that's a person, they don't have an eviction on their record, they're able to find somewhere. The issue that we're having is there aren't as many places in the community to now rent and go into.
Right.
Right now rentals are at a premium. So the dollars needed to get into some place are higher. So we can help with security deposit. We can help with what's called prospective rent, which is rent moving forward. Mm-hmm. So if you don't have any due, you're not behind on your rent, we can still help you. We can only do that in 3-month increments. One of the things I forgot to mention when I was talking about evictions that we've done, because we've seen the increase in processing time for everyone else, is that we're automatically approving 3 months of prospective rent if they're eligible for it. So, we had been doing it where you had to come every month for that assistance for months moving on. We're automatically doing that if you're eligible for another 3 months. To, again, try to recognize the fact that it's slowing down because of the increase in evictions. So if you're income eligible if you have a COVID financial impact, we could potentially help.
Okay, thank you so much, Ian, I appreciate it. Catherine, I have a few questions for you as well. So quarantines canceled 2 preseason games. As we approach the regular season, will there be random COVID testing for football players?
There will not be random testing. I think that everybody's pretty much heard from the panel today that would actually cause quite a problem for the community at large, with testing being not something that's super easy to come by right now. And it wouldn't be apropos to test seemingly healthy players. In addition, they could test negative and be exposed and quarantined the next day, which would also, potentially lead to another cancellation of a game if it's keeping our students healthy and making sure that we're not adding to the exposure wherever possible.
Okay. And the district saw more than 3,000 quarantines on Tuesday. Has there been any discussion of closing schools this year, or are the number of quarantines creating any staffing issues?
So most certainly, quarantines are heavily impacting our schools, not just for our students and their parents who have to potentially stay at home with them, but also for staffing. Closing schools is not something that we take lightly. There's a lot of consideration put into it, and it's not a decision that we make on our own. We work very closely with the Department of Health, pretty certain that our team talks to them on multiple occasions every single day. At this time, we're not looking to close any schools. It's certainly not something that we want to have to do. There are a couple of scenarios under which that would happen. If we reached a certain threshold where we don't have enough staff due to quarantines or whatnot to safely operate that school. However, we do have extra staffing available in terms of people at the district level that can come in and serve in schools where needed. Several of our leadership team and administrative team have all served in schools in several different capacities, so we at least have that option. That closing a school would be the last resort, but we certainly will if it becomes necessary. In terms of whether or not our schools are suffering staffing shortages, absolutely. Quarantines are impacting every type of business, and the education business is no different. Again, all we can do is make sure that we're supporting our schools from the district level, which is what's happening, and working through this pandemic together. And as John said, everybody doing their part, good mitigation practices.
Okay, I got one more for you, Catherine. How does Brevard Schools District decide which students are identified as needing to be quarantined?
I think that's actually a great question for our Department of Health team, because we take all of our quarantine protocols straight from the Department of Health through the CDC guidance. So I'm going to throw this one actually over to our Department of Health team.
So that's right. We do rely on the frontline folks to identify those students who were immediate contacts to the case. So greater than 15 minutes total contact within 6 feet. So that's a starting point, and we look at that and then do our best to quarantine around that case. And that's speaking to the importance of quarantine. It's one of our best measures to, again, prevent further spread within the schools in our attempt to keep the schools open.
Yeah, and thank you so much for that explanation. We also just want to make sure that we reiterate, as he mentioned, our school teams on site are doing an amazing job of keeping seating charts. There are all types of different logistical things that they've done to make sure that we can track people's movements through schools, keeping their classes in certain sections of the school wherever possible, making sure that we know where students are at in their classrooms. So it helps to assist how many people we need to quarantine, who needs to quarantine, and it's keeping our staffs very busy, obviously.
Okay. One more for the Department of Health. So why are hospitals canceling surgeries, be it elective or cancer or any other related surgeries? We know that this is a problem, and I feel like we've touched on this before, but can we go back over that?
Yeah, hospitals are canceled because of staffing. They need staffing and they need space. So they need the space. They're using some operating rooms for ICUs. they're having to use every existing staff person that they have to manage the onslaught of what's going on in the hospital.
Okay. And Commissioner, for you, people are curious, what is the board going to do about, offering more help to Brevard County residents? Of course, we always get asked about mask mandates. We get asked about testing sites. Is there any insight that you can give us on, what the board thinks of how they can help?
Going forward, I would have to say no, because it would be a board decision, and I'm just one
Right.
board member.
Of course.
So I would have opinions, but they really don't mean much unless I'm discussing them in the company of my fellow commissioners.
Right. Okay. Dawn, I think that's really all we have time for today.
Okay, thanks, Jesse. I want to thank our panel for being here today, and a special thanks to Commissioner Smith from District 4 to being here with us as well. We had a little later program today because of a meeting conflict, but we will be back next Friday at 11:30 for our next update. Please join us then. Thank you.